to promote and support the health and well-being of Indigenous communities by ensuring that public health programs and services are culturally appropriate and accessible, and to engage in meaningful dialogue and partnerships with Indigenous leaders and organizations to address health disparities and work towards equitable health outcomes. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous peoples. May we have the roll call, please, Madam Secretary? Member G4? Member Bauer?
Sir.
Member Carr?
Present.
Member Chung?
Present.
Member Dudas? Member Gower?
Here.
Member Kavanaugh?
Present.
Member King?
Here.
Vice Chair DiGiovanni?
Present.
And Chair Kins. We have quorum. Thank you. We don't have any regrets this evening. Are there any declarations of interest? Seeing none. Confirmation of minutes. Confirm the minutes of the meeting of December 2nd, 2024. Was confirmed. Thank you. Motion to introduce reports, Member Carr.
Be it resolved that the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Confirmation of the Chair and Vice Chair for 2025, Selection of a Hiring Panel for the Recruitment of a Medical Officer of Health, and Appointment of an Interim Medical Officer of Health, in camera, personal matters about an identifiable individual, reporting out date not to be reported out, be received and considered.
Ms. Carey? Great, thank you. So we have a short agenda for this special meeting. Item 7.1, Chair of the Board of Health Verbal Report will be held. Item 7.2, Medical Officer of Health Verbal Report will also be held. Item 7.3, Confirmation of the Chair and Vice Chair for 2024. Is this carried? Thank you. Item 7.4, Selection of a Hiring Panel for the Recruitment of a Medical Officer of Health. We will hold that for discussion. And item 8.1, Appointment of Interim Medical Officer of Health. Is that received? Hold. Okay, so we will go in camera for that item. We will circle back to my verbal report. So Kwe, Anin, Shikan, Tanshi, Nukut, and good evening, everyone. Thank you for coming together for this special meeting of the Board of Health. In December, we learned the bittersweet news of Dr. Etch's appointment as the President and CEO of CHEO. This evening, we are coming together to plan the next steps in determining the path forward for her replacement, but it also offers us the opportunity to recognize her incredible contributions as Medical Officer of Health for Ottawa Public Health. Tonight, we will be seeking to determine an acting medical officer of health, which we've done. Congratulations, Dr. Arneson, as well as appointing a selection panel responsible for the recruitment for Ottawa's next medical officer of health. It will be no easy feat to fill the shoes of Dr. Etches, but I look forward to navigating this process with all of you. As chair of the Board of Health, I have had the pleasure of working with Dr. Etches week in and week out over the last 2 years. However, before then, her name was not unfamiliar to me. Dr. Etches became a household name in the city of Ottawa as she led and supported us through a historic pandemic response. Her work at the helm of Ottawa Public Health helped to inform and reassure residents while planning critical services to help with the prevention and spread of COVID-19. She and the team at OPH were recognized for their exemplary work with the key to the city of Ottawa. The words equity, prevention, and impact are focal points of the OPH strategic plan, and these words have guided Dr. Etch's work over her 15 years with OPH. Elle a laissé sa marque sur l'organisation en concentrant ses efforts sur le renforcement des capacités pour favoriser l'équité dans le travail à l'échelle de l'organisation. Par son travail, elle a souligné le rôle unique que joue la santé publique dans la santé de la population et la prévention, tout en encourageant le travail en partenariat et en tirant parti des possibilités d'intervention en amont, notamment en influençant les politiques à tous les niveaux. I can confidently say that her reputation is nothing short of exceptional, not just within our city, but across Ontario and Canada. Dr. Etches has shown a consistent commitment to making an impact in the community and has continually promoted this with the OPH team. She has worked to promote these ideals with the next generation of public health leaders by exemplifying the values of servant leadership in her work, but also in taking the time to teach and mentor numerous public health medical residents over the course of her time with OPH. I am often in awe of how she manages to juggle so many responsibilities with grace and efficiency. Her leadership style is a perfect balance of confidence, strength, and empathy, setting the bar for us all. Her ability to lead with both determination and compassion is an inspiration to many, and I feel incredibly fortunate to have received her mentorship in these areas. It is a model I will carry forward throughout my career. As we say farewell to Dr. Etches and begin a period of transition, I am confident in that OPH continues to be guided by its mission, vision, commitments, and strategic plan. En 2025, Santé publique Ottawa continuera de s'appuyer sur ces bases et de faire progresser les efforts visant à améliorer le bien-être et à améliorer les services axés sur l'équité qui sont éclairés par les diverses populations d'Ottawa et qui en sont le reflet. The OPH team has consistently demonstrated their capacity to respond to community needs, build productive partnerships, and advance shared goals. The OPH team's expertise, supported by a stable senior leadership team and robust governance, will continue to deliver results for Ottawa residents. In closing, and on behalf of the Board of Health, I want to thank you, Vera, for your incredible contributions to Ottawa Public Health and to the City of Ottawa and our residents. We wish you the best in your new role and look forward to great things to come. As a small token of our appreciation, I would like to gift you this Ottawa Public Health jacket. On behalf of the OPH team, I hope you wear it with pride and fond memories of your time with Ottawa Public Health. That concludes my verbal report. Sure, there's no questions, but if anyone has comments. Is that carried? Thank you. Item 7.2, Medical Officer of Health verbal report for the last time from Dr. Etches.
Well, thank you. I definitely will carry Ottawa Public Health, not just on the logo, but in my heart. Thank you for those kind words. I'll show everyone Quay. Please bear with me as I'm feeling a little more philosophical this evening as I'm transitioning from one organization with this mission to work together with the community to promote and protect health and well-being for all people in Ottawa, to a different health organization where the focus is on best lives for children and youth and their families. So my final Medical Officer of Health update is directed to you at the Board of Health. It's directed to you because you continue, and it's an important role you play to provide leadership and governance to this organization. I also want to speak to all Ottawa Public Health employees. Your work is so important and it makes a difference in the lives of all people in Ottawa. And I also want to let the people of Ottawa know that certainly Ottawa Public Health will continue to be here for you and support you with all of our public health services and our collaboration with so many health care partners and others. So I want to start by just acknowledging how meaningful public health work is. Most of us have some experience with illness in our lives, and it reinforces for us, whether it's just this respiratory season or more serious things, that without health and well-being, everything else is difficult. Our work, our relationships with our family, our social activities. And it is Ottawa Public Health work that is so vital to provide this foundation of health in our community. It enables people to live well and live better. And I think that's the key, that it's making a difference, not just for individuals, but for the whole population. Whether you're talking about from before you're born and the planning of a pregnancy through to older age, Ottawa Public Health is there providing health promotion support. And, we can just picture it every day, whether you're biking down the street, which is right now very challenging, I'm sure, or watching your children play soccer. I mean, OPH is there influencing policies to prevent injuries, to protect the health of everyone. I do see that the people of Ottawa Public Health are motivated to do their work, not solely because of recognition of their work, but because they care about this community. And I do know it's important management practice to recognize, people's individuals' contributions, team members' contributions, and we build on those positive things and see when you're in the right track. The other thing about public health is how you collaborate really stands out. It's a beautiful thing to see. And so in my role as medical officer of health, I did continue to build on and foster relationships for collaboration. But it's the whole team at Ottawa Public Health that every day behind the scenes, they're quietly partnering to shape and share work. And I want to give some examples of this. Specifically, I think many of you know that Ottawa Public Health people are there writing funding applications that will then help many other organizations in the community, whether it's to catch up on childhood vaccines or recently to improve outreach services and connections to safe spaces and treatment pathways for people who are experiencing the toxic drug crisis and homelessness or impacted in the community. Another way Ottawa Public Health collaborates often is convening and bringing diverse partners together, really to have more capacity to collectively address community priorities. And examples here again recently include supporting older adults and people with disabilities during emergency responses, promoting joint planning of healthcare and housing so that we can have more capacity for people to be successfully housed when they have mental health and addictions needs. Preventing suicide is a collective project where Ottawa Public Health is there convening and promoting training, whether internally to the city or across many partner organizations, with a focus on those who have the greatest barriers to health and information. And the efforts of the Suicide Prevention Coalition include work to have a youth nominated support team when it's needed, and post-vention supports, and help media even on reporting safely about suicide. We're collaborating on the Overdose Prevention and Response Task Force. We've heard about the Mental Health and Substance Use Health Dashboard, but that was public health convening many, many partners to get a better understanding of what are the needs in our community and how can we shift towards more solutions. We've been convening and working on increasing primary care attachment. And we know that there's other things that happen to, for example, increase access to pediatric dental care. So sometimes Ottawa Public Health is doing that convening. Other ways that you work is to strengthen community action. So many initiatives come from the community, and you're there co-designing resources and intervention with people who have that lived and living experience so that they are more effective, and so that what people see they need to have for their health is advanced. And I appreciate, that one of these things was we helped with training of medical students so that there was less stigma in the healthcare system related to mental health and addictions. I could go on, but I would say another way we collaborate so that we have effective work is around the area of strategic communications. So it's really working with partners in schools, with healthcare providers, different cultural groups, to make sure that our communications reach all of Ottawa's diverse communities, making sure the messages are culturally relevant, making sure we're using diverse channels, not just social media and traditional media, but multilingual resources. So all of that involves collaboration. The next thing that I see that is more unique about public health work is how you influence environments and you influence policy. really public health organizations like Ottawa Public Health, we act on the knowledge that health is profoundly influenced by the physical environment, the social environment, our work environments. And I really love to see how you as a board evolved our vision to not just be about the well-being of people, but of the places and environments upon which we depend. Les organisations de santé publique agissent en sachant que notre santé est profondément influencée par nos environnements physiques, professionnels et socioculturels. J'aime la façon dont Santé publique Ottawa a fait évoluer notre vision pour inclure le bien-être non seulement des personnes, mais aussi des lieux et des environnements dont nous dépendons. And so some of the OPH team members that have been behind policies that have changed our school environment with more resources for mental health online to support teachers to deliver that curriculum. We're changing childcare environments by making sure that nutrition and physical activity guidelines are implemented. We've been looking at how we adapt to climate change by prioritizing trees and shade and electric vehicle and bike parking. And the way our city physically grows through the city's new official plan and the draft zoning bylaw. How people are treated with infectious diseases like tuberculosis and HIV. We've influenced that within the health system. And infection prevention and control approaches in congregate settings like long-term care homes, retirement homes, and shelters. That's just a few of the environments where you're at work. A couple more things I just want to emphasize in terms of your work is just how efficient you are. And we know recently the province dug into the provincial funding formula for local public health units. And I was so proud as we looked at those numbers to see that Ottawa Public Health has been able to lead in many areas, despite being one of the lowest provincially funded health units on a per capita basis. And the bigger picture here about our resourcing is that except for that massive growth and then shrink right back down during the COVID response is that the number of Ottawa Public Health employees has only grown by 1.2%. That's 6.2 full-time equivalents over the last 14 years. And that's at a time of 25% population growth in the city of Ottawa. So I do hope that funders will recognize that Ottawa Public Health has consistently operated with cost effectiveness in mind. Through continuous self-review and prioritization, Ottawa Public Health has implemented innovative digital solutions to help manage our increasing workloads. And despite being underfunded, we've consistently outperformed expectations, and we will continue to seek support of the various levels of government to expand our team to better meet the growing needs of our community. Santé publique Ottawa a mis en œuvre des solutions numériques novatrices qui aident à gérer une charge de travail croissante. Malgré notre sous-financement, nous avons constamment surpassé les attentes et continuerons de solliciter l'appui des divers ordres de gouvernement pour élargir notre équipe afin de mieux répondre aux besoins de notre collectivité. So you keep learning and you use multiple types of evidence to inform your decisions. I would like to think that I've helped with increasing the ways we hear from clients and community members so that we can assess and respond to health needs more effectively. However, this culture of being open to input, to keep learning and developing is really long-standing at Ottawa Public Health. And I love how the science of epidemiology and those ever-evolving dashboards that they create is really married to the qualitative input and the broader academic, political, economic, social, technological, legal, and environmental context so that we have a full view of evidence to inform our work. So lastly, I just want to say you are ready for the future. And as I think about it, I'm thinking about how in the realm of public health, our imperfections, they really highlight the continuous journey of learning and adapting that's required to meet the evolving needs of our community. And somehow, despite our best efforts, there's always more work to be done. There are more gaps to be addressed, more lives to be positively impacted. And these gaps are opportunities for growth and innovation. They remind us public health is a dynamic field, requiring constant vigilance, empathy, and dedication. And so by embracing our need to keep learning, we can better understand the diverse health goals of the communities we serve and strive to create more effective, inclusive, and responsive health solutions. It is through this ongoing commitment to improvement that we truly can make a difference. En embrassant notre besoin de continuer à apprendre, nous pouvons mieux comprendre les objectifs de santé diversifiés des communautés que nous servons et nous efforcer de créer des solutions de santé plus efficaces, inclusives et réactives. C'est grâce à cet engagement continu envers l'amélioration que nous pouvons vraiment faire une différence. So Ottawa Public Health has the systems in place for continuous improvement. We have a strong strategy, a supportive board. We're diversifying our leadership. We're renewing our quality framework. So I encourage all of us, you, to keep finding ways to gain and share feedback with each other. Whether it's community members to the board here at this table, or whether it's the board to the staff and the team, cross management within teams, just encourage that ongoing two-way feedback and always acting on employees' input. And so what I most wish for the Ottawa Public Health team as you go forward into 2025, it is joy. Joy in seeing your work make a difference for people and populations in Ottawa. I have a great faith in the people of Ottawa Public Health that you will continue to find such moments of joy as you support colleagues through difficult times. You listen to clients, you adapt OPH services, you build the partnerships, you generate new evidence, you measure your impact, you gain support from elected officials for healthy public policy, you express your creativity, pursue justice, just make things better. So thank you for including me in your journey these last 15 years and for your ongoing dedication to the people of Ottawa. Je voudrais aussi dire merci aux résidents d'Ottawa. Thank you to the people of Ottawa who really do most of the work of supporting each other's health across our city in countless ways, often using Ottawa Public Health resources to support informed decision-making. So, Tina, merci, miigwech, thank you very much. Dr. Eshes, question? Member Cap.
No, I don't have a question. I just wanted to say that it's been a privilege to work with these last 6 years. You went through a really difficult time with the pandemic, or took us through a difficult time. That took consistency. Just holding on to things. There was so much going on, and it's hard to forget. But it's over and above that, we still had everything else to do. It's now getting back into focus of things that are necessary to happen. But just personally, I want to thank you. It's been a privilege to be with you on this board.
Thank you, Member Kavanaugh. Well said. Not see other hands, so is this item received? Great, thank you. So we will move to item 7.4, selection of a hiring panel for the recruitment of a medical officer of health. And before we discuss the report, I'm pleased to welcome Pam Lemestre, the city's Chief Human Resource Officer, and Laura Greenwood, Program Manager for Human Resources, who are both in attendance this evening. And I would like to thank them for their support as we begin this important recruitment process. During the Christmas holidays, I had the opportunity to connect with a few board members and requested their participation in the recruitment process. So I am grateful for the willingness of Member King, Member Bauer, and Vice Chair DiGiovanni to join me in ensuring we have a diverse and fair panel to conduct the search for our new medical officer of health. We will be working with an executive firm to lead this process and to ensure that we find the best candidate for the role. I was also able to connect with neighboring municipalities who have scheduled time with Dr. Moore in the coming weeks to gain insight on best practices as our search. So please know my door is always open to the board for questions, comments, and suggestions. And at this time, I would like to open the floor for any questions about the report or the process or the selection panel if there are any. Yep, Member Bauer.
Perhaps this is premature, but there was reference in the supporting documents about some of the human resource challenges around this level of shortages of perhaps qualified personnel. I just wondered if provide a bit more context to us at this point.
Sure, thank you for the question. The medical officer of health must be a licensed physician to practice in the province of Ontario, and the role for City of Ottawa does expect that people will have a specialty in public health and preventive medicine. So the number of trainees that finish their specialty training each year is limited in Canada, and the number of people who have the required years of experience it is maybe also limited. That said, there are public health preventive medicine specialists with experience out there. We are hearing from people who have tried to recruit recently that there are candidates that are looking for new opportunities. So I think Ottawa is a great city to live in, and it's an excellent team, as I just described. So I do feel that with their enough strategies in place to reach out to people that you'll get.
Thank you. I'm not seeing any other questions. So I'll just read out that the Ottawa Board of Health for the City of Ottawa Health Unit established a selection panel for the hiring of a medical officer of health, and that the selection panel shall include representation from the chair, the vice chair, one citizen member, and one council member of the Board of Health. And that the selection panel be authorized to collaborate with the City of Ottawa's Human Resources Department to secure the services of an external executive search firm, leveraging their expertise for a thorough and effective recruitment process. Is that carried? Great, thank you. So we'll now go in camera. So we're more clear out.